Hello, my name is Audrey Harrington, and I'm going to be talking about cirrhosis today. Cirrhosis is a disease of the liver in which liver cells become damaged and are replaced with fibrous tissue, which leads to scarring of the liver. Meaning, anytime your liver is damaged, where your liver could be damaged from a disease, alcohol, a car accident, anytime your liver is damaged, it causes scarring of the liver. And the more scarring that your liver has, the worse off that you're going to be. Because if your liver has scarring, it's not going to be able to function properly because it has scarring. So the more you drink, the more you damage your liver, the more chances you got of the cirrhosis of the liver, of your liver ended up not functioning properly. There are a lot of signs and symptoms of cirrhosis of the liver. I'm going to go over some of those. Some of those may be pain in the stomach, bleeding, dark stool from digested blood, fluid in the abdomen, nausea, vomiting blood, and as far as your whole body, you will have fatigue, you will have loss of appetite. Your skin may start looking kind of yellow. You may have yellow eyes. Your eyes may start looking yellow. You will have swollen blood vessels. And just depending on the individual, some may gain weight and some may lose weight. It just all depends on that person. What causes cirrhosis of the liver? I'm going to talk about the main two causes of cirrhosis of the liver, which would be alcohol, and the other cause of cirrhosis would be a viral infection such as hepatitis B or C. Other causes of cirrhosis could be from increased fat collection of the liver, or it could be diabetes, or if you have any issues with your bile duct, that could cause cirrhosis also. Which organ is affected by cirrhosis? Well, of course, the main organ that's going to be affected by cirrhosis, of course, is going to be the liver. But also your stomach, your spleen, your pancreas could also be affected by cirrhosis of the liver also. The role of the liver is it metabolizes, it detoxifies, it stores and produces substances. The liver also produces bile that we need in our body. And I'm going to talk a little bit about the blood supply. The blood supply in the liver, one portal that the liver has is called the hepatic portal vein. And there are also a hepatic portal artery. In the hepatic portal vein, blood comes through, which is rich in nutrients in which our body needs, but it is poor in oxygen. But our liver needs oxygen in order to, stay alive and, be healthy. So the oxygen comes through the hepatic portal artery instead of the vein. And I'm going to talk about the hepatic lobules, which is the functional unit of the liver. And if you was to open up the lobules and cut it in half, it would be a hexagonal shape, and you will see the common bile duct, the hepatic portal vein, and the hepatic portal artery, which is the functional unit of the liver. Treatments and medications for cirrhosis. It just all depends on how early that person catches how early that person learns that they have cirrhosis. But if you're caught it early on, you will be advised to stop drinking. If you're overweight, if you're obese, that would encourage weight loss. And if you contracted cirrhosis of the liver due to a viral infection such as hepatitis B or C, then you will be given medication for, hepatitis to help with cirrhosis of the liver. But if you're bad off, if say like a heavy alcoholic and their liver is just scarred and it's just, it's eventually about to, give out, then they may need a liver transplant. It just all depends on that person and what their doctor would advise them to do. Complications of cirrhosis could be high blood pressure, swelling in the legs and in the stomach, an enlarged spleen, malnutrition. How they would officially diagnose you with cirrhosis of the liver, they will run a blood test on you, and when they run the blood test on you, they'll be looking for excess bilirubin. They will be looking for any kind of malfunctions in your blood, or they may decide to give you a biopsy, or they may do an MRE in order to determine if you have cirrhosis of the liver. Another complication that cirrhosis causes would be portal hypertension. And portal hypertension affects your pancreas, your spleen, and your stomach, which will cause your liver to malfunction. Once those organs are affected and it will cause your liver to malfunction, that just worsens, the chance of your liver coming back from it, because once the liver is damaged, it's no coming back. It's irreversible. That's why once your liver is damaged, it tries to rebuild itself, but whenever it tries to rebuild itself, it's actually scarring itself, which is scarring of the liver, which is cirrhosis. So it's just it's the best thing for you to try to do is just try to stay away from alcohol, because you don't want to continuously be damaging your liver over time. Say if you're an alcoholic and all you do is drink, your liver is getting damaged horribly, which would be a bad case of cirrhosis of the liver, which is life-threatening, and you can die from cirrhosis of the liver. So just in order to prevent it, just try not to drink, try to maintain a healthy weight, try to reduce your risk of getting hepatitis if you can, try to stay on a healthy diet. Actually, more men than women die from cirrhosis of the liver. The first known description of cirrhosis was discovered by the Hippocrates in the 5th century. The term was invented in 1819 from the Greek word for the yellow color of a dead liver. In conclusion, I had an aunt and she died from cirrhosis of the liver. She was an alcoholic. And, that's why I chose this topic for my project. And, just learning about it, it kind of brought me, it gave me awareness, because I was a child when it happened. But doing this project, it gave me awareness of what was going on. And now I have a better understanding. So I would just try to encourage people who I know that are heavy drinkers, try not to drink as much. If just try not to drink as much. Try to stay healthy and just try to be positive, so you won't contract cirrhosis of the liver. And also try to stay safe from, getting hepatitis B or C. And some of my references would be the Mayo Clinic. And I actually used one of my books that I had at home, Acquiring Medical Language, which is my medical terminology book. I had some good information in there also. And I also got some information from Wikipedia. And I just want to point out that the hepatic lobules do all the hard work of the liver. And I believe I covered everything that I needed to talk about. Thank you. Have a nice day.